Have you ever wondered if your cholesterol is causing plaque formation in the lining of your arteries? Well, there is a special ultrasound that will actually go and ultrasound the wall of the arteries in the neck. You can do what they call a carotid intimal thickness. It'll ultrasound on both sides. This special ultrasound will look at the lining of the arteries to see if there's plaque formation, because just because you have high cholesterol or you've been told that your cholesterol is okay, how do you really know? Well, with this special ultrasound called a CIMT, it's the carotid, which is this part of the artery of the neck, intimal thickness ultrasound. And what it's doing, it's looking at the wall of the artery. So, and this is a cartoon of an artery, and you can see that this should be a normal artery towards the end at the bottom. And as you go across, it's showing that plaque formation can build up. And what this ultrasound does, it goes in millimeters and will look at the wall of the artery and show if there's plaque formation, how many millimeters there is, and if it's stable or unstable. So if you want more information about this, you should check out about the CIMT ultrasound, which is more in depth than just a plain regular ultrasound looking at plaque in the artery. So I'm going to go through and explain what we're looking at with calcium buildup in the artery. So this is a cartoon display of an artery that's been cut in half just to show you the wall of the artery, which should be 1 cell layer thick, and how there's a muscle layer, and how when you start having cholesterol buildup, you can get like calcium, plaque, build up in the wall of the artery. So when you have elevated lipids, they will go in, I always say the little small dense particles will get into the wall of the artery, and then they'll start building up plaque and calcium and such. So Cleveland Clinic actually came out with these markers for inflammation that we can now measure in the blood. And this is what I do with my Cleveland Heart Lab that I do. That's an advanced lipid panel. It's not just the old-fashioned way of looking at the total cholesterols, but it's really just looking at what is this lipid doing? Is our cholesterol doing? Well, not only that, with our lifestyle, when you put everything together, that can build up plaque. So you can see here that this is what we call the intimal thickness, and in millimeters in a normal artery, it's very, very thin. So a millimeter is like a hair thin. So with this ultrasound that we're doing at the office, that comes about every 3 months, we get a company that comes in and they will ultrasound this artery. So we're looking at, here's the blood flowing, going through the artery. And what happens when you get plaque buildup, it can rupture. And when it ruptures, it sends signals and you get a blood clot, and that's when the blood stops flowing. That's when you get a heart attack or a stroke, or if you get a lot of plaque buildup over time, it can lead to dementia, what we call vascular dementia. So I'm going to go into more detail, kind of showing people with this ultrasound. We're going to show the demonstration of the ultrasound that comes from the company that comes in and measures this wall in millimeters, which is not what regular ultrasounds do. When you go to get an ultrasound of your neck, it will not go into this detail. And then also how we can measure these levels, these inflammatory markers in the blood that gives us more information.
Oh, it's so nice and warm.
Yeah, I've got a gel warmer on it. There we go.
So can you point out like some of the artery?
So here on the screen, we've got the skin looking down into the body. This is muscle, and then this is the artery running here. The bright white is the fascia on either side. Black is where the blood flow is going, and then this little gray line here is the intima media. And when we go to make measurements, they will literally zoom up on it about like that, and in that space there will be over 100 measurements measuring between that layer and that layer to determine how healthy the arteries are. There's about 600 measurements that get made, each one to the tolerance of 1/3 of a human hair, and with that we're able to determine how old the arteries are in comparison to a database that was collected with about 40 years of research. Most people would think, oh, I want my arteries to be exactly my age, but you don't, unless you want to be average. You would rather have your arteries be 5 to 10 years younger than you so that you're living a healthier life. And the great news is, even if it comes back looking your age or, God forbid, older, 20, 30 years older than you, I know firsthand it kind of feels like you failed the test, but in reality, there's no way to fail this test. As long as you have a doctor who knows what to do with it and are a motivated patient, this tool can help you identify that you need to be doing something different, and you can treat medically with diet, exercise, lifestyle, and in some cases supplements and maybe medications. It's hard to say. You can have a huge impact on the health of your arteries, not just in your neck. This test has a 96% correlation with the vessels throughout the rest of the body, and the big concern is those things that kill so many people, heart attacks and strokes. And with this having 96% correlation to those vessels that can't be ultrasounded and see the detail of that lining, we're able to get kind of a secondary look at those arteries. And when you treat medically, what happens here is going to be happening throughout the entire body. There's tens of thousands of miles of arteries that you can treat, all with those simple things of diet, exercise, and lifestyle, and having a good doctor to help figure out what needs to be addressed and how to go about it, because everybody's so different. You got to have your own plan. You can't go off of what just one person says about everybody, because nobody's the same. But you can have an effect on tens of thousands of miles of arteries all at the same time. If you go for surgical intervention, those plaques, and again based off of their measurements, not off of their side effect, which is huge, because most of the time you'd have to have a plaque that was blocking way up in here and maybe even coming down here to have anything change in the flow. When if you've got something that is, let's say, that thick, that wouldn't seem to be too bothersome, but that little bit right there would be enough to be concerning to me, to have something that big. And when we know about it early enough, we can do something about it. That's the magic of this, is being able to turn it around.
Yeah, finding it in the really small stages in the millimeter form, and that way you really nip things earlier and be proactive and preventative.
Absolutely. And then
instead
when you
of
do
like
that,
a regular ultrasound just does like what you're doing, this part right here, and it doesn't really tell you anything. And what you're doing though is looking at the millimeters and seeing if there's something really early that you need to be really proactive and get after it much faster and really reverse things before they turn into something worse.
So this is the Doppler that they would do, and so you can hear that. And if there was an occlusion in there, it'd be like whoosh, 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 real sharp, harsh sounds. And that's the kind of thing, I mean, it's not optimized there because that's not really what we do, but that's an example of what traditional carotid ultrasounds rely on, and you literally have to have a 50% blockage before anything would show up on that method.
Yeah, that's what's so bad about the regular ultrasounds. They're just not specific enough.
No.
And that's why this one is so good, is because you can really fine tune it and get down to the nitty gritty of the early stages. And you said again, like they said, the soft plaque, you can pick up if it's a soft plaque, which is the one that's concerning because it can rupture, and then the H one is the heterogeneous, which is in between, and then the E is the echogenic, which is the hard plaque that is stable. And so it's kind of like I always say mortar in the bricks. It kind of, once it gets in there, it's hard and it's stable. But yeah, so this is looking at all the different arteries. This is good.
So this is the artery looking lengthwise, and then when I turn my transducer, we can track it. There's the circle of the artery, and as we move up, we see how it goes up here and it widens out, and then boom, we've got two arteries. This one's feeding your brain, and this is feeding the face and the thyroid.
Nice.
Yeah, it's pretty cool.
They're pretty.
They
She's got some pretty arteries.
Definitely. So we'll wipe this side off here, and this is a totally forget.
So very comfortable, right? And just not invasive, and just So we
And
can,
relatively quick too. It's 10 to 15-minute appointment, 10 minutes of actual scanning, and really
you can
gets
see
some
her.
detailed information.
This is great. And we'll get a really detailed report, and it'll compare to her previous as well.
Yes. Now, there are some people out there that will do CIMT and give you an immediate report, and I'll tell you, I wouldn't put any weight behind those, because I know for a fact the software on these ultrasound machines pales in comparison to what we will need for an accurate report. I've done my own little testing on it, and on the same exact image, using the same exact measurement tool in the same exact way, I got 3 different results using an ultrasound machine. As good as this is at making images, it's not good for making the measurements that we need. Our readers have proprietary software that allows them to apply those 600 measurements down to the tolerance of 1/3 of a human hair, and give such great accuracy that if I sent your test into 2 different readers with cardio risk and asked them both to read it independent of one another, their results would come back identical. And our sonographers are tested as well to be sure that we're providing an accuracy to the readers. We double-blind test our sonographers to make sure that we're all doing exactly the same method in the same places at the same way, so that the reproducibility is there, so you can know if what you're doing is actually working, or if there's room for improvement and tweaking of treatment, because what works for Mary may not work for Paul, and knowing what you've got is important.
Look at the pretty arteries.
Yeah.